Hi, Dr. Del Grosso at SF Chiropractic. Let's talk a little bit, just briefly, a little bit about hip pain. Okay, a lot of times people come in, you're having pain in the hips, and sometimes it's not even necessarily the hips, it can be what we call the SI joints or the sacroiliac joints. And a lot of times hip pain is caused not so much with a problem in the hip itself, but a problem with pelvic balance or pelvic leveling, where things are off a little bit in the pelvis, where there's some rotation in the pelvis, where the ilium's rotated, and causes and puts stress on those bands and starts to put pain out into the hip and across the band there and down, the side of the leg. Another thing can be if you're flat-footed or the way you stand or your stance. This also can affect the hip and the hip pain. Okay, one leg will appear shorter than the other. Okay, it's not actually shorter; it just appears that way because of the pelvic unleveling and the problem with the balance or rotation in the pelvis. So if you're having hip pain, don't just assume it's your hip or something. Come in, let's take a look. A lot of times it can be coming more from the spine and from the low back or from, like I said, the pelvis itself than anything else. And it's not something that's really difficult to manage, to take care of, to correct. So come in, let us take a look, and we'll see what we can do to try to get rid of the hip pain and get you back on track again. Thank you.